Hi everyone, I'm Kisha, your host of Beauty and the Wise, the ultimate lifestyle and wellness podcast where we empower women over 40 to redefine the narrative around aging gracefully. Aging well, empowered aging, healthy aging, some even call it anti-aging. But we are here to give you all the tools and tips that you need to embrace this journey. We will have industry insiders and guests, friends come on board to discuss topics ranging from hormonal health, fitness, nutrition, sexual wellness, personal development. Nothing is off limits. We want to be able to help you to advocate for your own health and well-being, all while doing it while falling in love with taking care of yourself. As you will know, in previous episodes, I have talked about my hormonal journey. I have said that I am in menopause and everything that I kind of went through. Today's guest is someone that I met a few years ago on this journey. She has helped me look at things not only from the changes of my hormones through different life stages, but holistically as to how I can approach supporting my health and well-being. Our guest today is Dr. Tiffany Keenan. Welcome to Beauty and the Wise.
Thank you so much, Kisha. I'm really happy to be here today.
I'm excited to have you. So I know we have lots to talk about, so let's just jump in and let's break it down for everyone. First of all, when I came to see you, I was more than frustrated a few years ago. No one actually told me I was in menopause, but a lot was happening. And so let's just start with hormones and hormonal health in women. What should we be thinking about when it comes to perimenopause or menopause?
So we really need to start understanding the changes from the time that we start having our menstrual cycle. And I really feel that's where education needs to go. So we go through this period where we're having regular cycles. Usually that's going on well into our 30s. And then as we approach our late 30s, we can actually start having the changes of perimenopause. And a lot of people get the concept a little bit, they're not really comfortable. What does it mean? So perimenopause is simply the time around the menopause. And menopause is 1 year after your last menstrual period. And then we go into post-menopause. So really, from your late 30s into early 40s, we're probably in perimenopause for roughly 10 years or more. And that's where the confusion lies, because we think, okay, I finished my last cycle, now I have to worry. But the changes actually start a long time before that. And, for me, that's when I really learned as well that's why I've gone on to study and learn so much about hormones, is because I was 41 when I started having the perimenopausal changes, which I didn't really understand what was going on. And really in healthcare, we really get limited education around the menstrual cycle actually and menopausal changes. So it's important for women to go out and make sure that they know what's happening. So knowing first the time frame that you're at, and then knowing that it's all very unique to every individual. So it's not a one-size-fits-all approach. If you want to have an idea about what your changes might be like, you can talk to your sisters or your mom, right? Because we do start to see things within families. But it's definitely a progressive course over a 10 to 15 plus year period.
Oh my goodness. Yeah. Tell me about it. So Dr. Keenan, let's take it back even further. Your focus is specifically on women's hormones, women's health?
So I look at the body as a whole, okay? So we are mind, body, and spirit. And, in traditional Western medicine, we see the body more as just a physical entity. It's like, okay, you're sick, so you take a pill for this, or you're sick, so you take a pill for that. But over the past decade, I've been exploring more about all the basis of health, and that's where we have to think about stress, our emotions, and how our purpose in life, how that comes to play. So I do that as part of a package, what I call is personalized lifestyle medicine, right? Because our lifestyle is going to impact us. And with so many women, I see that once we actually make lifestyle changes, then the hormones can start to come into balance. So hormones are one piece of the puzzle, but it's in the context of the whole entire woman's body.
Yes, lifestyle, like you said, it can impact our hormones and our life. So we know that there's so many symptoms when it comes to these changes that we experience. Can you kind of give us some guidance, or what will women be going through? What is it that they're going through, and the risk associated with not treating them?
So let's start with the changes, okay? And just for a basic understanding of hormones, because that can help us. So there's two major hormones that most of us have heard about, and that's estrogen and progesterone, okay? So what happens after we start 40 years old? Generally, progesterone goes down first. So progesterone is a hormone that's released from the egg as it's developing in us, but our eggs start to drop off after our 40s, which is why it's harder for women to get pregnant, right? So progesterone goes down first. So when progesterone starts to drop, we start to feel things like difficulty sleeping. And that's often the very earliest sign before any hot flashes start to come. And then we can start to have problems if we don't sleep so well and we don't have as much progesterone, with a little bit of brain fog starting to kick in, okay? And then we can start going into our mid-40s, then maybe some of the hot flashes are also starting to begin as well. So there's a general decline in progesterone. The other important thing that progesterone does, it really helps to stabilize the uterus. So when the uterus is not stabilized, then we can start to have problems with our cycles, right? So most women will understand this, like in their 40s, their periods weren't the same as what they used to be. Maybe they're a little bit longer, maybe a little shorter, maybe a little bit more heavy. And then that starts to increase more and more as we get closer to the time of menopause, which is around 51, 52 is the average age. So progesterone is kind of making this gradual decline. Then the other hormone that comes into play is estrogen. So we hear a lot about estrogen as well. So estrogen goes through this little roller coaster, right? So just like when we started having our cycles, we had those teenage years. Sometimes the periods were all over the place. We got a little bit more moody. Things stabilized for a couple of years. But then as we come out of that regular cycle, then we start to get a little bit moody again as well, because estrogen fluctuates. So Dr. Pryor, she's a gynecologist from Canada, and she describes it as the roller coaster of perimenopause.
Okay.
But when we understand this, Kisha, it makes it like knowledge is power, right?
Absolutely.
And so then you start to say, well, this is what's going on. This is why 1 month, I'm feeling like I'm really on a short fuse, or I'm crying all the time. I'm not feeling good. I just can't concentrate. I feel overwhelmed. And so that's when we start to see more that estrogen levels start to drop.
Okay.
But then it can fluctuate so much in women. And some of it can be based on your genetics as well, because some women will go into a time where they're not breaking down their estrogen as well as they were before.
Okay.
And so we're getting an imbalance of estrogen versus progesterone, okay?
Okay.
Because everything in the body, we're yin and yang, right? It's a night and day. So we have to get those hormones into balance. So what will happen during that time is sometimes women, again, will have the heavy cycles, but maybe they'll be diagnosed with things like fibroids, okay? And then maybe they'll start to have more problems even with acne, with skin changes, because estrogen and progesterone are out of balance, and then testosterone can come into play at that time. So it's that cycle that we're going through. So declining progesterone first, then estrogen, it's going on its ups and downs. Then as we get closer to the menopause time, then we can start to have things as well, like the vaginal dryness, right? And a lot of women don't really know what's going on. They start having more pain with intercourse. They start having more bladder infections, maybe more yeast infections as well, because of the changes that are going on down below, right?
Exactly.
So we have to look at the context of hormonal changes with progesterone and hormonal changes with progesterone and estrogen, but then know it's on a continuum. Because then when you hit menopause, which is just a year after your last menstrual period, things will still begin to change. And that's when women start to often notice memory changes. Like, I'm forgetting my keys. Like, I can't remember.
Mid-sentence.
Right? And that's the impact that estrogen in particular has on the brain.
Okay.
Right?
Okay.
So we know that there's those changes that will happen. And then we start to have the impact on our bodies, right? So we kind of think, we've talked a little bit about the sleep, hot flashes, but then what's happening to our body? Weight gain, right? And women come in all the time. And in Bermuda, like so many of my patients, they are like on top of their fitness. They're eating well. And then all of a sudden, it's 5 pounds, it's 10 pounds. It's starting to creep up Because what happens as estrogen goes down, many women can develop insulin resistance.
Okay.
So what is insulin? So many of us know it as a hormone that's involved with something about diabetes,
Yes.
right?
Yes.
So it really has an impact on your blood sugar. So as we get closer to menopause, we don't actually metabolize carbohydrates as well as we used to when we were younger.
Okay.
So, the bread, the potatoes, the pasta, that sort of thing. And that's because of the decline in the level of estrogen in our blood. So I see a lot of women come in, they're in prediabetes, and they're like healthy and
What's
fit.
going on?
And they're like, what is going on? So when we look at getting their hormones balanced, we can help get rid of that prediabetes before it gets out of control.
Oh my goodness, Dr. Keenan. We have so much to unpack here. Okay, so let me look at it from my story.
Yes.
I know when I was going to the doctor, it was for, one piece of the pie. I needed this to be fixed, or I needed this. What can women, or what would you suggest women need to ask when they go to the doctor? They don't even know what to even ask, or how to even articulate this. What advice would you give to someone that they know something's happening, they know something's changing? What are they asking for? What sort of tests should they be requesting from their doctor?
So first is really having knowledge. Mm-hmm. And many people know of Louise Newson. She's a doctor in the UK. So Newson Health is a wonderful resource for women.
Okay.
Because even Dr. Newson has a letter written. This is what you can take to your physician when you're concerned about your hormones. Okay. But what you want to ask is, okay, if you're over 40, and you're starting to have hot flashes, difficulty sleeping, depression, anxiety, weight gain, high cholesterol, high blood pressure, or prediabetes, is say to your physician, I wonder if this could be perimenopause. Okay? So first bringing that out into the context. And then once you see your physician, you want a full, complete baseline of blood testing. Okay? Now, there is not one specific test that's going to tell us you're in perimenopause. Mm-hmm. Okay? Mm-hmm. Now, menopause, there's a blood test that, of course, usually it's the lack of your period. But some women that might have had a hysterectomy, they might be wondering, well, what's going on? So there is a blood test called FSH, and that can tell you if you're done, especially if you've had a hysterectomy. But for people that are early on, you want a general profile. And why is the reason for that? You want to know what's going on with your blood sugar. Really important. You want to look at even blood insulin levels, because for many women, your blood work may not show up that you have prediabetes, but insulin resistance can show up even earlier. Okay. So that's a specific test. You want to look at thyroid. And why is that? Because a lot of cases of low thyroid actually happen around the perimenopausal period.
Okay.
So women that were diagnosed, it's often after their 40s, between 40, 50, 60. So you want a full thyroid panel to be done as well. And then, of course, you want to look at the basic things like your blood cholesterol to see what your numbers are like. And then you can ask your physician about getting your blood levels of hormones checked. Now, this is really going to depend on the interpretation by your physician, okay? It doesn't mean that you're not in perimenopause because there is not one blood test, but it can help us look at what's going on, in particular with progesterone, because progesterone is the one that goes down much more quickly during your cycle.
Okay.
And we can look for low levels of progesterone, and we can look for high levels of estrogen, especially if you're someone that's maybe having fibroids or difficulty with your periods.
Okay.
So there's other tests that we can check for. We can check for a blood test called DHEA, which is a naturally occurring hormone in our blood that declines with age. But it can also be present for some women if they're DHEA and testosterone, if they're having things like polycystic ovarian syndrome.
Okay.
Right? So the perimenopausal period can be really a time of change. Postmenopause, it gets a little easier from a blood perspective because most hormones have really dropped off by that time.
Okay.
But basically, you want a full blood panel, and then you want to look at, so your basic test that a doctor would do, your hormone test, and then your nutrients, right? Mm-hmm. So the key nutrients to look at is vitamin B12. So vitamin B12, yes, it's found in food, but it's mostly found in meat. So if you're vegetarian or vegan, you may need a supplement.
Okay.
Also vitamin D. So a lot of people think that, we live in vitamin D, we get lots of sun, but many people can have an issue that they don't absorb vitamin D.
Okay.
And why is vitamin D important? Because these other hormones, estrogen and progesterone, and even thyroid hormone, they need vitamin D as part of this wonderful cascade of hormones within our body. Because our body doesn't work in isolation. So one thing is going to impact the next, that's going to impact the next, okay? So asking for that full blood panel will be a great way to get started with your physician.
Okay. Well, definitely that's helpful. And like you said, you touched on nutrition, you touched on fitness. All of these things make a difference, especially when it comes to managing the stress, because again, you're going through these changes and you probably don't have any idea, but you need to find ways to manage it because it's all connected.
Right. And one of the biggest things, especially early on, is stress. And why is that? So stress creates a chemical in our body called cortisol. Okay. So when we're worried about things, or if we're not happy, or basically our busy lifestyle these days, we're often in this state of elevated stress. When cortisol is high, it impacts progesterone. So remember, that's the hormone that I talked about early in your 40s is going to go down.
Yes.
And then if you have more stressed, it's going to give you the perfect storm. So starting to think about your stress levels in your early 40s is really going to start to make a difference.
This is a lot. So you also mentioned, we've been talking about hormones. Obviously, when it comes to which one is up, which one is down, women need to make a decision in regards to treatments and therapies or some sort of alternative ways to support their journey. Any advice that you can give or any kind of information that you can give when it comes to decision making?
Right. So the first thing is to be informed, to know your body. So really understand what's going on. And a lot of times we don't. When I work with patients, I pull out the menstrual cycle, I pull out the hormone sheet, and I'm sure I showed you this as well. It's like my black book,
Yes.
because I want you to understand where you are and so that you can make that educated decision. So once you know where you are, then you have to say, well, what are the lifestyle things that I can do? And do you want to speak on lifestyle first?
Let's go there.
So let's start on lifestyle, because lifestyle are your pillars of health. And if you work on those, it can minimize the need for some individuals that need hormonal replacement therapy. Okay. So the 4 pillars that I work on are, one is the breath, one is what we eat, so our nutrition, how we move, and how we rest. Okay. So when it comes to the breath, this really goes with stress management. And so I know that you meditate, I meditate as well. So we know that when we get our body into a state of calm, it can help, number one, to lower our cortisol, to get our body more relaxed. So whatever type of breath exercise you're going to do, because many women often feel that they're short of breath, they're just kind of hyperventilating all the time. And as soon as we can work on the breath, we can start to feel better. Okay.
I'm actually sitting there holding my breath. I don't know why.
And that's it. And often we do. And often, we're having so much fun, Kisha. But when we're a little bit stressed and we think, oh, we have so much we want to discuss, but often you might feel you're holding your breath at work. And so here in Bermuda, I'll put in so Beth Hollis is a physiotherapist, and Beth does a lot of work in breath management. She looks at the way we breathe.
Oh, wow.
Because a lot of us breathe from our upper chest.
Yes, and not down.
And not from our bellies, right?
Exactly.
And so this will actually heighten our stress response. So we need to learn to abdominal breathe. And of course, if anyone's been to yoga, usually yoga class will really talk about that.
Exactly.
So we really want to work on the breath to start with. And then we want to look at how we eat, okay?
Okay.
Because nutrition has a huge role to play in terms of our hormones. Like I said before, one of the changes that starts to happen, especially mid-40, is this estrogen's going down, insulin's going to go up.
Okay.
So if you're already eating a diet that's really high in starch, if it's high in processed foods, then the body's going to start to have problems.
Yes.
So many of my patients, when they come in, I first start to say, what are you eating, right? If you're drinking tons of sugary drinks and beverages, whether that's, coffee loaded with sugar or lots of Cokes, or even a lot of these kind of energy drinks with all these artificial sweeteners, this is not good for our body, right? So you really want to look at nutrition. We want to look at whole foods, and we want to look at, our meal timing to make sure we're getting enough nutrients. Because one of the things I see here, especially in Bermuda, is everyone has been on a diet. Well, what woman Hasn't been.
Exactly. Exactly.
Right? So we're often thinking about we have to restrict ourselves.
Yes.
But we actually sometimes need more nutrients,
Okay.
right? And that's what whole foods can provide, in particular protein.
Yes.
And as we go through this time, we actually need to up our protein compared to when we were younger, because our muscles just need it because of the changes that are going on with the drop in our hormones, okay? So we want real food, whole foods. And then when it comes to movement, okay? So as you're going through this time period, I say to women, I said, you know, your 30s, early 40s, no problem. You got away with it. You didn't have to go to the gym. But I said, nature's coming, right? After your 40s, you need to do physical exercise. And the key thing is walking is good, but we really need muscle strengthening and conditioning, right? So why is that? Again, the change in our hormones. Estradiol and progesterone are both going down. So our muscles have receptors for all these hormones within them. So we need to work on maintaining our muscle mass. And one of the key things as we go through these changes is really targeting muscle training. So whether this is at home, you're doing some body exercises, there's all kinds of great stuff we can do. And I'm sure you'll have some fitness individuals on, you know, to talk about that.
Yes.
But we definitely need to work at muscle mass training.
Okay.
Because why is muscle training good? It's going to support your bones. Because one of the conditions as we get older is our bone health goes down. Some women develop thin bones or osteoporosis. The best way to strengthen your bone is with muscle training, right? So that's got to be something that we need to consider as part of the package. And also in the muscle, when we build more muscle, we build something called mitochondria.
Yep.
So mitochondria, that's the little battery within our cells. Because as we go through menopause, often we feel tired all the time.
Absolutely.
Right? And so, yes, hormones may play a role in replacing them, but if we can boost our mitochondria by boosting our muscles, we're going to feel good right away.
Okay.
I had a patient actually just today, and she is having some difficulties with weight gain. She was on Ozempic. She lost some weight, but she said, Dr. Keenan, I know that I felt so good when I was doing my bike every day. And she said, I want to do this first. I'm going to do my exercise. She didn't want to go back on Ozempic because she said, when I was doing exercise, my brain was so clear.
Yes.
I felt so good. So we know that a lot of the changes of exercise are going to start to make our brain feel better.
So, Dr. Keenan, just to pause right there, what's more important, the strength training or the cardio? Because I have this conversation with a lot of my friends in regards to weight loss when you get older is a lot more difficult. But I also think strength training, like you just said, is important as well. Or is it a mix of the two?
It is a mix of the two. The way we train definitely changes, though, after 40. So what I see a lot of women do is overtrain. Okay. So when you're training, especially for weight loss, you want to train at what's called your VO2. You want to be in zone 2 training. So some fitness people kind of know that, or if you looked at your watch, sometimes it'll say zone 2 training. I'm so fortunate now because I actually have a device that allows you to measure your metabolic rate. Okay. So we put it on, we strap it on your face, you get on the treadmill, and you're able to see what is the zone of training that you need to be in. Because a lot of people think I need to go to the gym and sweat it out. You don't. Because what happens is when you sweat it out, if you're going really intense, like on the Peloton, for example, right? Because that's super hard, you're going to break down your muscle. And when you break down that muscle, it's going to be really hard to restore it. And also, it's going to raise cortisol in your body. What does cortisol do? It triggers insulin for fat storage. So a lot of women need to go a little bit slower in terms of the intensity of their cardio. Okay? So that's the cardio perspective. So often cutting it down a little bit. Okay? Then when it comes to weights, you want to work hard and not a lot. So you want to have 3 sets of maybe 6 to 8 reps. Because when we're young, we're like, doing 12 to 15 reps of something. And you're thinking, oh, it's good to tone me. But as we get a little bit older, we actually need to lift harder and less. Yeah. So Dr. Stacy Sims is an exercise physiologist, and she has a book called Roar. And she writes a lot about that, how training needs to change as we go from, premenopause into perimenopause and then even into postmenopause.
Okay. Okay. All right. Okay. Back to the pillars. So we were on nutrition. Yes.
Nutrition.
Nutrition.
That's right. And then we went into movement.
Exactly.
Right. And then the next one is rest and sleep.
Okay. Yes.
So this is a two-edged sword, okay? Because often the first thing to change is your sleep as you go into perimenopause, but really making sleep a priority. And so this is getting a sleep routine. And we spoke about this before because you're so much into skincare. But like I said, so we have a morning routine, we have a nighttime routine, but we need to make it our bedtime.
Yeah.
Right? So what we need to include in that is downtime away from devices. We have to get away from watching the news right before bed. And we have to focus on relaxing our bodies before sleep. Okay. Also, we need to make sure that we get rid of stimulants in the afternoon because some women will start noticing that coffee has an impact on them, both for their sleep, but also for hot flashes. Okay. So even after 12 for some women, and also that evening glass of wine.
Oh, yes.
I was victim to that, right? And it's to the point now that I actually have given up alcohol because it's just not worth it.
Yeah.
You know, because I noticed very clearly in my early 40s, if I had alcohol, in particular red wine, I was going to have a hot flash and not sleep.
Absolutely.
Right?
Yeah.
And that's a given. So those are lifestyle choices that we need to make. Because once we prioritize sleep, if we do everything we can, then again, we're going to have an easier time adapting because sleep is vital. It is the heart and soul of what we are. It's one of the 4 pillars because if we don't sleep, we don't restore our bodies. Okay. So what does it mean to restore? So at nighttime, again, all these wonderful hormones in our body, we basically have a clean out, okay? Our blood flows through our body, but also we have what's called the glymphatics. This is the lymph glands. Okay. And they circulate through our cerebral spinal fluid and they clean out all the toxins within our brain. And we need to prioritize sleep to get this. Because what happens if we don't? Then we're going to start to have some chronic conditions. Autoimmune conditions can rise for people that are chronically sleep deprived. So things like thyroid disease, maybe even rheumatoid arthritis, lupus. We know that Alzheimer's disease has been linked to individuals that have poor sleep because they're not clearing out at nighttime. And we also know joint aches and pains because, again, our body's not able to clean itself up basically at nighttime, and we can have more pain and inflammation. So sleep is a key pillar. So those would be the 4 key lifestyle pillars that I would say that you really want to get in order. And the thing is, you don't have to have your physician tell you that.
Well, you had to tell me, definitely. Because when I came to see you, that was exactly what you said. Let's sort this out first, because you're right. I wasn't sleeping. I wasn't eating properly. The weight, I might have gained weight, but I wasn't losing anything. And yeah, I needed to start there. That is exactly where I had to start.
And sometimes we just don't know, right? Because the other part of those core pillars, which one would be, is taking care of our skin and our bodies. So for women, it's so important to pay attention to the products that you use.
Absolutely.
Right? So there's a website called the Environmental Working Group. And so you can go on there because a lot of skincare products can actually negatively impact estrogen in your body. So they're called xenoestrogens, and it means outside the body estrogen. So things like phthalates and BPAs and all this, they're actually linked to cancer.
Absolutely.
So this is something that women really need to be aware of as well.
Paying attention to the ingredients.
The ingredients of what you're using. And then the other way is how we detoxify our bodies. Okay? And so that's why alcohol really comes into play here, because we know that over 7 to 8 drinks a week is going to raise your risk for breast cancer. Okay? So alcohol is a toxin, but also it has a role to play with estrogen. So alcohol is one, but the other is the way that things come out the other end. And, we don't always talk about it.
Exactly.
But it's, what are your bowel movements like? Because I bring this up with every woman, right? With every patient. If you're prone, for example, to chronic constipation, because estrogen primarily is detoxed through the stool, right?
Yes.
So we have to poop out the end products. If not, what can happen is things go on within our gut, and it can lead to kind of heightened levels of estrogen within our body. If on the other end, you have irritable bowel, then you have to think about how well is your estrogen being absorbed in your body.
Okay.
So our bowel movements, just like our menstrual cycles, are part of one of our vital signs for health. So again, for women, I often want to get that in order as well, even before we start talking about hormonal therapy.
Okay.
Okay.
Okay. And this can take a while before we even get to the point about hormonal therapy.
Right. Exactly. Now, some women will come in and it's very clear. They come to see me. They're 55 years old. They've been done their periods for a couple of years and they're having so bad hot flushes that they can't think. We could just go ahead and start them on hormones right away. If they're up to date with their other kind of testing, you don't always have to wait.
Exactly.
Right. But if you're younger, then you want to get that in order, right? Because those pillars are really going to impact what's going to go on with a lot of other diseases that can happen too.
Got it. Okay. That makes sense. That makes sense. Okay. So we look at our 4 pillars, we figure out what's going on. We do the testing, we do the blood work, we figure out what our whole story looks like.
Right.
Then what's next?
Okay. So then it depends on where you're at. Okay. So if you're in perimenopause, if you're in your early 40s, there's actually some supplements that can really help. Okay. So one of them is something called Vitex or chasteberry. So it's very natural. And what it does, it naturally boosts progesterone, right? Because I know there's a lot of people in Bermuda that don't really want to take any kind of drug at all. So a lot of times we can start that very early on. You can also get natural progesterone, which is it can be sold over the counter to boost your levels, okay? We want to look at some nutrients that can help you as well. And then as you're starting to get more closer to the mid to late 40s, often the hot flashes are starting to come more. So then if we want to look at supplements, we might think of something like the plant-based estrogens. Okay. So the plant-based estrogens, these are things that we can get from foods. So, from walnuts and flax seeds and even soybeans.
Okay.
But there's some supplements that have higher amounts of these. Okay.
Okay.
So there's a few brand names like Femguard HF, because it's broken down these types of phyto or plant estrogens, which can be very good for us through the transition time. Okay. Promencel is another brand. You can find a lot of these in just some of the health food stores or even at some of the pharmacies in Bermuda. Okay. So they can help as we're going through some of the changes. If you have fibroids, then some women will need a product called DIM. So DIM is what's in broccoli, right?
Okay.
So we hear a lot about broccoli, and broccoli is really good for us. But broccoli can help with the way that we detoxify our estrogen.
Okay.
Right?
Okay.
So it's a custom approach for many, many people. But there's definitely like a lot of supplements that can help assist through that transition.
Okay.
And then we get to, okay, maybe you've tried the supplements and things aren't working, they're not going so far. Okay. So that's where women, sometimes they want to start right there.
Yes.
And sometimes they really do need it. Okay. So one of the things to understand now is that the prescription medications that we use are different than the prescription medicines that were used 20 years ago.
Okay.
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 Because people get confused. What is bioidentical? What is body identical?
Yes.
Right? So when you go to your physician, we have a few options of what we can prescribe. Okay. So when it comes to estrogen, most doctors now are prescribing estradiol. So estradiol is similar to what's made inside our bodies.
Okay.
20 years ago, we were using a lot more Premarin, which was what's called a horse estrogen. Okay. Because it was made from a mare's pee. Okay. But most of us aren't using those type of estrogens anymore. So we're using estradiol, which is the same. So it's body identical. It's got the same structure as what we make. Okay. So most women need to understand that because they're really worried that if my doctor gave me a prescription, I'm worried that it's synthetic. Okay.
Yes, absolutely.
So it comes in the form of estrogel, which is a pump that women use. And you can put it on anywhere from twice a day, 2 to 4 to 6 pumps as needed. Or it comes in the form of a patch. So the patches go by different names, Climera, Vival, and they come in different strengths. The patch, you put it on twice a week, and it's just a slow release patch. Okay. So that's the estradiol. Now, estradiol also comes in a pill form. Now, I'm not a big advocate of the pill form, and that's because when it gets broken down in the body, it goes through the liver, and then we lose some of the estradiol, estradiol it goes into other components like estriol and estrone.
Okay.
And it needs a detoxification or a metabolism process, okay? Through that process in the liver, it can very slightly elevate your clotting risk.
Okay.
So that's when women get worried about clotting on hormones. So the topical, you have nothing to worry about.
I was just going to say, the topical sounds
it's the
better.
safest.
Okay.
That's right.
Okay.
But if you use a pill, there's a very minimal clotting risk.
Okay.
But that clotting risk also exists with the birth control pill.
Yes.
Which most of us kind of forget about, okay? But most of the time I would put on a skin-based, okay?
Okay.
So that's when we come to estradiol. Now, estradiol can also be used in other areas. So if you're having any vaginal dryness, any pain at all with intercourse, frequent bladder infections, then we have a little vaginal estradiol that's used. Okay. It's a tiny, tiny little pill. It's the size of like a baby aspirin.
Okay.
And you put that up in your vagina and it can help with those symptoms.
Okay.
So that can be used along with the topical creams.
That you're already using. Okay.
Yes.
Got it.
Because we have estrogen receptors in many places in our body, but we have a lot right in our vagina, okay? And we want to keep that area nice and plump.
Okay.
And not just for the reasons of intercourse, but really for vaginal health. Because we don't want to get a lot of atrophy. I see a lot of women with dryness and bleeding, and then they end up in their 60s with recurrent bladder infections. Okay. So you really want to start that early.
Okay.
Dr. Rachel Rubin is a urologist from America, and she really speaks openly about this because she's starting her patients in their 70s on vaginal estradiol. Because a lot of reason for death later in life is for bladder infections that move to the rest of the body.
Oh, wow. Okay.
Right?
Okay. Okay.
So there's another area that estradiol can be of use as well. Okay. Up here. So this is your area.
Exactly.
So we know one of the big changes that happens is we start to get wrinkles.
Yeah.
Okay.
Changes in the skin. Yes.
And this is primarily an estrogen related change in our body. Okay. So we know that dark skin has more melanin, right? And I'm sure you've spoken about that. So often you have a lot less wrinkles. But for some of my Caucasian patients, I'm really seeing the wrinkles and the changes. Okay. So estradiol can also be applied on the skin. Right? Okay. So we don't use a gel, we use a cream that needs to be made here in Bermuda at special pharmacies. Okay. It needs to be prepared a special way. But some of the chief dermatologists in America and the menopausal physicians, and we have research that supports the use of estradiol being used for the skin.
All right, I'll have to look into that one.
Yes, we'll talk more about that one. So our estradiol, I think we've covered most of that. So then the next one that comes about is progesterone.
Yes.
Right. So progesterone, again, comes in different forms. So the form that we want to use is the body identical form called progesterone, okay? So when you were on birth control, or many women might be on birth control now, you think it's just you're on estrogen and progesterone, but you're actually on a progestin. Okay. So there is a difference. So it's different in the way that your body uses it and metabolized because it's a synthetic formulation and it doesn't look like your body's natural method. Okay. So some women might go to their doctor and they want to be they might want to put them on a combination that has something like Provera in it, or medroxyprogesterone acetate. And there are combination pills that you can get, which I don't use I don't use it all in my practice because I much prefer using body identical progesterone. Exactly. So in Bermuda, it goes by the brand name Utrogestin or Prometrium. Okay. Now, typically this is given in pill form. Okay. So estrogen we want in skin form, but progesterone we want in the pill. Okay. 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 Now, why is that? So the reason that we want, and it can be both ways, but majority of women are on it in pill form because when progesterone gets broken down, it goes into our bloodstream and it creates a breakdown product called GABA. So GABA. Some people have heard about this because GABA is a neurotransmitter that really can make us feel sleepy. Okay. And it's a hormone that can make us feel good. Okay. So some women might think about when they were pregnant. When you're pregnant, you make a lot of estrogen and progesterone, but the progesterone's really, really high. And that's what gives women the glow and makes them feel really good. So that's why we often will use progesterone in an oral form, because it's going to make you sleepy at night.
Okay.
And the majority of women want to get that
exactly
sleep
want the help
at nighttime.
Exactly.
Right?
Okay.
So, but progesterone can also be used in a skin cream as well.
Okay.
So if it's used in a skin cream, so many physicians only are aware of the pill form because that's what is in the traditional formulary. But why would I want to use it in a cream form? So for some women, they don't, if their gut is not balanced well, sometimes they'll have some digestive issues with progesterone as a pill.
Okay.
Okay. So if that's the case, you can take progesterone in your vagina. Okay. You can take the same pill that you swallow and put it in your vagina.
Okay.
Because it gets absorbed there
Same place.
as well.
Exactly.
Right? Or you can have it specially made at a few pharmacies on the island.
Okay.
So, and then we can kind of customize the dose a little bit more.
Okay.
So those would be the main two. So estradiol, and then we've got progesterone. And then the next one we talk about is testosterone. Right, ladies?
Yes.
So we can need this one as well. And it's not just about libido, okay? Because even with men, and I want to put a plug in for men that might be listening, or women, if you're listening for your husbands, because all of the things that I listed for women, you know, the fatigue, the brain not functioning, maybe not being mentally clear, maybe he doesn't want to do stuff so much, maybe he's losing his muscle mass, or if he's been diagnosed with diabetes, that's because testosterone is going down.
Okay.
So for women, especially once we get beyond 50, testosterone is really going to start to drop off as well. It's a little bit different than estrogen and progesterone, because estrogen and progesterone are related to our menstrual cycle.
Yes.
Okay?
Yes.
So when they drop, when our cycle stops, they stop. Now, testosterone is made in different areas within our body, so it's a much more slower decline.
Okay. Okay.
So sometimes women might say in their 40s, oh, I'm 45 and I want testosterone right away. It can be very important then to test for testosterone, because during that time when the hormones are fluctuating, remember we said everything needs to be in balance?
Yep.
Sometimes what will happen is estrogen and progesterone drop, and testosterone then looks like it's relatively high.
But it's because the other two have dropped.
So that can be sometimes when women start getting acne
Okay.
in their late 40s, or like they're in 50s and they're getting
About acne. Exactly.
Right?
Okay.
So they may not need testosterone right then. So we sometimes will want to get a blood level.
Okay.
And then, so sometimes after the 50s, then we'll start testosterone. And also the way that our body works, it's a wonderful way that it's all these hormones work together. Generally, we want to get the estrogen, estradiol, and progesterone on board. And then after, 3 to 6 months, then we'll start the testosterone.
Okay.
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 So why do women need it? Of course, libido and sex drive. Yes.
Yes.
But you want it as well. It can help with skin. Okay. It can help with joint aches and pains, because that's another big symptom of menopause we don't speak about. Frozen shoulder syndrome. Why am I getting this back pain? Why is my knee aching? Because of those, the hormones that have dropped. But also we want it for our bones.
Okay. Okay.
So that hormone can be super important when it comes to bones, because if you already have osteopenia in your 50s, you definitely want to think about hormonal replacement during that time. So we've got, then the last hormone to think about is DHEA.
Okay.
Okay. So DHEA, again, it makes a very slow decline as we age, and we can have a blood test that can measure for DHEA, and you can then take a supplement for DHEA. Now, in Bermuda, DHEA is actually sold over the counter.
Okay.
So there's probably a lot of women listening that are already on it.
That are on it.
Right?
Oh, when would you get tested for this? Like what would prompt you to get tested for this?
So
for DHEA?
It can be part of your hormonal testing.
Okay.
If you're getting things tested.
Okay.
Now, some people have just started it because it's known as the longevity hormone.
Okay.
So when it comes to our hormones, we have precursor hormones and then we have end hormones.
Okay.
So DHEA is a precursor, okay? Because if you start with DHEA, you can get a little benefit from estradiol and a little benefit of testosterone. So some women, and that's why it was sold over the counter, because it's generally regarded as safe. Now, the problem is for some women that have gone out and went and bought this DHEA, they might have got into a little bit of problem with acne or weight gain because it can start to impact things if you're taking too high a dosage.
Okay.
So I really like to empower women. And I love Google. I love it when patients come in and went to Google, but I say, okay, what are you taking? Why are you taking it? Because some things can be more harmful than good. And that's why it's really important to work with a practitioner that understands the full spectrum of things, because we really have to look at supplementation because we don't want to over or underdo it.
Okay.
But those would be the prescription ones, estradiol in a gel or a patch, progesterone in a pill or maybe a cream, and then testosterone, sorry, I should say that comes in a cream, okay, or a gel. We really have to look closely at testosterone. We don't have a specific formulation for women. So what does that mean? I can't just give you a prescription and say at the pharmacy for women, go and take, 2 milligrams of testosterone. So we have to use the formulation designed for men at a very low dose.
Okay.
Or again, we have a few wonderful pharmacies in Bermuda that mix it in special dosages.
Okay.
Yeah.
Okay. Yeah. So this is a lot for the first doctor's appointment. But this is why it's important to build that relationship. Because like you said, you're coming in, you need to test, then you need to try it. Then you need to test again, and then you need to try something else again because you need to figure out what works and what doesn't.
Right. And it changes. For me, I went through menopause when I was 48, but then 2 years ago, I had my ovary out, and then my hormones went through another little dip. I noticed my muscle mass going down more. So it is a transition. So what you're on at 48 most likely won't be the same as what you're on at maybe 50, 52, or at 55.
Okay.
And so also don't get frustrated in the beginning because sometimes women come in and they want everything to happen overnight.
Oh, yes. Right away.
Now, the one thing I can say is when you're postmenopausal, it's quite a bit easier to work on things. And we can get you at a good dosage much easier. And that's because you're basically out of everything.
Okay.
When you're postmenopausal. But when you're perimenopausal, it's more complicated because you're still having periods, but they're spacing out. They're sometimes every 3 months. They're sometimes every 2 months. Sometimes you're bleeding heavy. Sometimes you don't. So the perimenopause, especially I'd say the age between 45 and say 52, it's the hardest to get your body in balance because naturally your body is going through these changes. And so it's the time for more patience and knowing that you will get through it. Because also, the big thing with menopause, it's not all these worries and the woes of menopause. There's a wonderful side after menopause. And I know when we're going through it, it
doesn't feel like that at all. But okay, I trust you, Dr. Keenan.
But there is, so I'm really big about brain health. Okay, so I do a lot of work and I research neuroscience. So Dr. Lisa Mosconi, she just wrote a book called The Menopause Brain. And they've actually looked at phases in a woman's life. So perimenopause, when we go through it, the brain actually can have some negative changes as we start to lose our hormones. But postmenopausally, the brain actually gets back to where it was before, and we can actually be stronger than we were. So women after menopause can be happier and more confident and stronger than they were during that menopausal transition.
We just have to get there.
We need to get there.
We have to get there.
And I really think that, Kisha, when I was going through it, I was so anxious. When I look now, I think of my poor husband. What was going on? And if I'd understood, it just would have made more sense for me.
Absolutely. And in hindsight, for me, I'm 47, I'm in menopause, but now I realize what I was going through before was perimenopause. I was a different person. Now that we're on hormones, we've got the 4 pillars, we're looking into that, the lifestyle changes. I feel completely different than I did maybe 5, 8 years ago. I had no idea. Yeah.
It's a huge change, and I see women come into my office and I feel for them because they're crying. They're so overwhelmed. Some of them are ready to leave their jobs. Some are ready to leave their husbands, right? And sometimes can be good reasons for both, right? Because we often gain more awareness as we go through this because we say that I'm not going to be a people pleaser all the time, that I have to empower myself, right? To know that self-care is super important. But women that are in that phase where they want to leave everything behind, when they get on sometimes that right hormonal cocktail, it can make their lives so much better.
Oh, yeah, absolutely. I agree. Dr. Keenan, thank you. We have talked about so much, but let's talk about how can we find you? Where are you? How can women, if they want to reach out, how can they get to speak to you? Tell us all about your platforms. What are you doing?
I'm a consultant in personalized lifestyle medicine. Okay. So what does that mean? It means that I customize a treatment plan based on you and your needs. Okay. I use a lot of tools as well for body awareness. So I think one of the tools I used was the Freestyle Libra. I think we did that with you, which is a blood sugar awareness. Also, I spoke a little bit about using the measure of our oxygen capacity of our lungs.
Absolutely.
And also I'll be doing work in brain analysis and looking at our stress response in our brain. I can measure the stress response in the heart. And so when we work together in that complete package, it really helps me design what's going to be best for you, because everyone is different. And, I see some individuals that come in, they want to go straight to hormones, and sometimes that works. And then I see the complete opposite end for someone that wants to do things as natural as they can, right? And so, at this point in my life and in my career, I'm so happy to work this way. I'm on Instagram and YouTube channel as well. And also I'll be continuing my work with the Bermuda Diabetes Association.
Okay, great.
So with the Diabetes Association, I do culinary education classes, because food is medicine, which is why it's one of my pillars. So that's another way to reach out. And also I'll be doing workshops. Because just like, we've talked here in under an hour, and we're talking about a lot of these topics. But what I really find is when we can sit around a table in a really safe space, when we kind of really build connection, because connection is one of my pillars too, that we know that we're not alone. And then I really find it's a great way for healing, but to understand these concepts. So throughout the year, I'll be offering regular workshops where both men and women will be able to come in for help.
Sounds good. Thank you, Dr. Keenan.
You're very welcome.
For today's episode, you can find it on inzuriwellness.com, as well as on Instagram at Beauty and the Wise, as we'll share Dr. Keenan's information. Dr. Keenan is welcome to come back. So if you have any topics that you want to get more information on, you can reach out to her. Or if there's anything that you think we should speak about even further on Beauty and the Wise, just send me a note. But thank you.